Okay, welcome to the Health and Healing Crusade, where we are going to speak with Lynelle DeRoo Marcos. She's a registered dental hygienist, international speaker, author, and founder of both Brush for Life and BFL International, a 501c3. Her trademark techniques for oral care can positively impact longevity and aging. She's an avid volunteer, contributing thousands of hours of service as a clinician and educator across 3 oceans and 3 continents. Lynelle's ultimate goal is to change the way the world brushes. Welcome, Lynelle, and we're so excited to have you and to feature oral health for our Health and Healing Crusade.
I'm so happy you did this.
We wanted to ask you if you can tell us a little bit about Brush for Life and BFL International.
Brush for Life I formed about 12 years ago, initially to have something to sell that's preventative oral care. Didn't take too long to find out it's very hard to sell preventative care. People are more interested in fixing something after it's a problem than preventing something before it is. So yeah, you probably have run into that. So I have morphed that into being the housing for my speaking. I do speaking engagements. So that's the business for that, and products that I use for preventative oral care for whoever wants it, medical, dental, because there's a crossover, as you'll come to learn in the talk tonight. BFL International came to be because I had done a vacation / dental education trip as a speaker in Kenya. And one of the other speakers there was a dentist, and he was giving his talk on dentistry in Kenya. There is one dentist for every 33,000 people in the country.
Wow.
So there's about 800 dentists, which cannot possibly serve the whole population. So there's a lot of mission trips that go over there. Anyway, I went up to him and asked, said, do you know anybody in politics or government or something? Because I think I can help. And so through a series of events, I ended up doing a study at a school there in Kenya. And I was asked, as I was wrapping up the beginning of the study, like you do beginning and end, if I would bring people with me to do dental treatment on those who were in the study when I came back to conclude it. And I'm like, I've been on mission trips. I've not done a mission trip. I'll try. And God answered my prayers, because it came to about 8 weeks before arrival, and I had like 2 hygienists and no dentist. You can't do dentistry without a dentist. And dentists there didn't want to volunteer unless you pay them. So I got on my knees and I begged God, please give me a dentist. And over the next 48 hours, I had 9 people sign up, and 1 was a dentist.
Awesome.
Wow.
Yeah, he's the best boss ever.
Wow.
So that then had, I had other people who said that they were interested in coming, but not this trip, next trip. And I'm like, well, the study's over. There's no reason for me to go back. But that's how it came to be, because then I thought, well, we'll do another trip, but I've got to have, dental units, with a handpiece and the air water syringe and everything. So I found somebody that would provide those, and it would be $3,000 to buy 15 of them. And a donor came up and she said, I'll donate the money, but I want a tax deductible receipt. That's why I made the nonprofit, because I'm like, give me a few days, I'll work on that. So that's how come I formed a nonprofit, which it's been a real blessing. It's God's leading is how that has worked out.
That's so exciting. Praise the Lord.
That is neat, especially to be able to assist individuals with oral hygiene here in the U.S., but also abroad as well. I remember when I was 7, we went to Kenya on a mission trip, and it totally blew my mind as a little kid, because there were little children playing in the mud with sticks, and they were having a blast. And I was concerned about the next bike or toy that I was going to receive, but you see that the way of life is completely different, and the way they take care of their health can be different as well. So I think that's really neat that you're making an impact in individuals' lives across the globe. So
Yes.
when we're talking about teeth and oral health, I mean, individuals may say, well, how does this really fit in with a health event? Or when I go to the dentist, it's something I dread. I mean, it's something I do once a year, maybe every 6 months, something I don't look forward to. What's the importance with dental hygiene or oral health for somebody's overall well-being?
Well, one of the most common issues, I'm going to answer your question, that you see in the dental practice is gum disease. 75 to 80% of the population that sees the dentist, that's how we would know, whether they have gum disease, because these are the people that come to the office. 75 to 80% of the people that go to the dentist have gum disease. Why do they have gum disease if they're going to the dentist regularly? And how does it impact their overall health? Well, the bacteria on the teeth, if they're not removed, they form a byproduct that, I'm going to put this in really like 5th grade level terms, okay? So we don't go into the weeds and doing a CE class, because that's not what we're here for.
Yeah.
We're here for that. It's something else. So it will form a product that creates a blood vessel nearby that's more permeable. So the bacteria can just like dive bomb right through the wall of a blood vessel. These bacteria have a very high clotting factor. So think about it. If you bite your tongue or you somehow scrape your mouth, it doesn't bleed very long. Have you noticed that? It bleeds a little bit, but it doesn't go on. You can't put a Band-Aid on it. So why does it stop bleeding? Because the bacteria in your mouth have a very high clotting factor. Now think about that. If those bacteria are getting into your bloodstream, what's happening?
Clotting, other areas of clotting.
That's right. And the smaller the blood vessel, the less blood flow there's going to be to that area, So there are 57 diseases that are found to be associated, not causative. There are 5 that are proven to be causative. Lots of research behind the 5. That would be stroke, which we just talked about, clots. So stroke, heart attacks. I've seen a patient who was sent by his cardiologist. He was going to have heart surgery, and his heart doctor said, you go and you get your teeth cleaned first, because we're not doing surgery and then having you throw a clot and you die, because that can happen. So stroke, heart attack, diabetes, and then preterm babies and low birth weight. There's been lots of research, so we know that gum disease can be causative, or there's one way and another of problems between the two. The others, there's studies that haven't been funded as well, the other subjects, where we see there's a relationship. There's just not been a lot of study, but some of the studies like infertility, fascinating research to read. I like to read research. And it was like they were looking at something else, and they noticed the correlation. In men, of course, it's easier to see if fertility changes right away. In women, you have to wait 9 months and period of time. But in men, they found they were looking at statistics from a fertility hospital, okay? And the men that had their teeth cleaned, before their cleaning, they were infertile. After their cleaning, they became fertile.
Really?
Yeah. And the women, same thing. So if you clean up, if you have a chronic infection that's creating a system-wide inflammation, because any kind of obesity creates a system-wide inflammation, right? Your body's trying to fight off this problem. If you have a bacterial infection somewhere in your mouth, that blood flow is going through your whole body, right? So your body's going to be like, something's going on here. I need to fight this off.
Really?
Wow.
So
that's very interesting.
For somebody who's watching this and they say, well, I'm using the dentist-approved toothpaste, I'm brushing multiple times a day, this isn't a concern for me. I'm not going to come down with gum disease. I mean, are we all at risk for this?
So you don't know what you don't know. And most people brush the same in adulthood as they did when they were 4. They carry into adulthood doing what they were shown to that affects and will work pretty much for baby teeth. But baby teeth are 1/3 the size of your adult teeth, okay? And then people in adulthood, if they do any kind of modification or change in their brushing, they'll do what they see on TV. Okay, toothpaste commercials, right? They're doing this or whatever. Those people are actors. They don't know what they're doing. Don't follow them as an example. So what you want to do is brush in a way that will get the bacteria in the areas where gum disease starts. If I may, I want to do a little illustration.
Yeah, for sure.
Yeah.
Okay, let's do this sleeve. Let's say this is your tooth, okay? And logically, people think, let's see if I can get my sleeve longer here. They think the gums come up to the tooth and just attach. But in reality, the gums come up to the tooth, dip down, and then attach, like my sleeve here. Now, most people brush like they see on TV, which is directly at the teeth. Let's do it this way, okay? They do this. Are they going to get in the turtleneck?
No.
No. So what we want to do is slide the bristles down inside the turtleneck. And then the other thing that people do is they literally brush because they've been told to brush. So they brush their teeth, right? We do this or whatever. But we're moving so quickly that we don't stay in that little turtleneck to make any effect. So what you want to do is work down into, get the bristles down into the turtleneck and then park there and just agitate the bristles in place. So I'm going to use my fingers. You're going to get them in here and then pivot on the bristle tips. So this is what I do. You want to do 2 teeth at a time, 5 to 10 seconds. Okay, so there's your visual aid. So you want to brush 2 teeth at a time and tear up the bacterial colonies. So you have to be in one spot long enough to do a good job. You have to use an angle that's going to get the bristles down the side of the tooth. Because if you don't, the bristles that don't clean off, I'm going to bring my sleeve down, this portion of the tooth, say this is up higher, that portion that the tissue is laying against will cause little ulcers to form inside of the turtleneck. And when you disturb those, they bleed. So when people tell me, oh, my gums always bleed when I brush, let me ask you, is it good to bleed anywhere? No, you shouldn't have blood coming out of your body. It's supposed to stay in. So bleeding means the body's trying to fight something off. So if you remove the irritant, the bleeding will stop. And one of the quickest ways to stop bleeding is to use hydrogen peroxide. Because the bacteria that live under the gums live without oxygen. Peroxide is H2O2. The oxygen gas is going to be released, and that's what the bubbling is. So then you're left with water. It has a slight kind of metallic taste. It's not too bad, but it will foam and it will kill the bacteria and stop the bleeding immediately. So we don't know how to brush, and because we don't know what we don't know, and people commonly make the 5 same mistakes. For 25 years, I asked people, show me what you do when you brush. I'd open up the brush and I'd hand it to them. And then they would start doing it. And I observed people make the same 5 mistakes. SMILE. So I was able to create an acronym. Actually, I prayed about it and God gave me that one word. And I'm like, smile. I don't get it. And then I thought about it and I thought, well, I show people where to start. Oh, that could be the S. And then I show them, of course, how to move the brush. Oh, that's the M. And I'm like, I have been doing this for 20 years and I realized it's an acronym.
Wow, that's great.
Yes. So I have this on a website, which I'll give at the end, with little videos that people can watch and follow along. Each of them is 2 minutes, so it's very easy to digest. And with the videos, because a picture's worth 1,000 words, right? You can see where you should start and how to move the brush, etc. All of the steps. There are some areas that people miss that I'd like to mention. When people brush, if they're right-handed, let me bring the camera back. If they're right-handed, they tend to do the front and the left very easily. We reach across ourselves easily. This is awkward. and then we flip the brush over, and this is easy, but this is even more awkward. So people that are right-handed miss this eye tooth area on the right side of their dexterity, because this is awkward, this is awkward. So since this is an easy motion, turn your face to bring those teeth to your shoulder, and now you can access them. That's the trick. I've seen 3 children this week. I work in a children's office where there's decay, like all of the enamel on the top half of the tooth is gone because of plaque there that they're missing. So parents that brush their children's teeth need to make sure the bristles point up and brush into the gum line and help the kids with these areas. The other thing that people want to ask me about is flossing. Do I have to floss? 40% of the tooth surface is not reached by your brush. Because where you're looking at a tooth, like say down here, these front teeth, you're looking at it this way and it looks narrow. But if you were to turn that same tooth sideways, this is the shape. So there's a big triangle of space. You may have a triangle here, but sideways you got another one, but it's upside down. That your brush bristles don't reach very well. So it's really important. So people may have really bad breath that isn't being fixed by just brushing, and that's because they've got gum disease. Usually it's between the teeth that it's going down and causes this really bad odor. It smells like a small animal crawled in your mouth and died.
Oh.
Yeah.
Because there's lots of little animals down there that are killing the tissue, and it is death. It smells terrible.
Yeah.
Wow.
Now, when you were talking about brushing and the ulcers bleeding, would that be the same as when you're flossing and you bleed as well?
Yes.
It's the same. So walk us through. I know you shared the importance in the technique on how we should brush, but what should our daily oral routine be like? Because I know individuals, they'll use mouthwashes or they'll use different types of water picks or toothpicks or floss picks, you know?
Yes.
And I want to know if you should floss before or after brushing.
It doesn't matter. Okay. Before or after is not relevant.
Okay.
I will brush, floss, and then brush again because I don't like all the stuff that I removed floating around in my mouth. And if I floss first, I don't like all that on my fingers. So that's why I do it that way. A soft nylon brush, don't use natural bristles because the bristle tip won't be able to be polished. And a cheap brush will have bristles. And you'll see this on my site. There's a lot of information. I have a lot of FAQs, and that's on there. I have pictures of showing a cheap bristle versus a good quality bristle. So a toothbrush that is soft or extra soft, which you'd have to order online, okay, because the stores won't sell them. Sometimes stores don't even carry soft. It just depends on who's ordering, because these people are not dental professionals. They order what sells, and people that don't know better will buy medium. Patients ask me, why did they make medium? Well, because it's a free country, and if it sells, they're going to sell it. That's why. So you want to have a good quality brush, electric or manual. It depends on your dexterity, okay? If you're going to use electric, please use an electric one that is shaped like this, not the round head.
Really?
The round head, yeah. You cannot get a round head to go at an angle into the gums. It's so big. It's made to mimic the polishing cup that we polish your teeth with.
Okay.
But the problem is it's 2 to 3 times as wide. That little cup is that size for a reason, so that we can get in between the teeth and adapt it to the curve of every tooth, especially the smaller front teeth. But I had somebody, I wish I'd taken a picture of it. He was trying so hard to make that round head brush do what he saw in commercials, which is his great car wash action. He was pushing really hard on his tooth. He burned a hole through the enamel.
No.
Yes. What? There was a little dimple and then a hole right through the enamel from him pushing so hard on the brush to make it spread.
Oh, wow.
Don't use the round head ones. I have seen so much gum disease with those round head brushes. So much. Heavy tartar under the gums. It's black because the iron in blood makes the tartar turn black, So from the bleeding. All right, so a regular type brush, soft bristles, or a sonic brush. The battery ones are too cheap. Get one that is rechargeable. My preferred brush, because I have some recession, is the Burst, which if you go to the site, you can click on the image of one under the FAQ, and it gives you a discount automatically, a professional discount that they give hygienists. So that way you can get like 40% off the brush, which is a really steal deal, right? It's BFL, just in case you're wondering. Amazon will cost more, I promise you, because they wrap the shipping price into the cost of the brush. And you won't pay that if you buy it with the discount code. Anyway,
wow.
So a good quality brush with soft bristles, and then your toothpaste. I am not a proponent of fluoride, which we can circle back and talk about that in a little bit. And there is on my FAQ, the toothpaste tab, a button. You'll see a toothpaste abrasiveness scale. Okay, so you can see which ones are good and which ones are not. You want to use a toothpaste that doesn't have a large grit size. Some people have brushed with charcoal, activated charcoal. That is not a small grit size, and it will be abrasive on the enamel. I don't advise that. Plus, it will get under the gums and get packed in there. And with the Cavitron, we're cleaning around, and these puffs of black clouds will come out because it's jammed under the gums. So no, I don't advise that. Yeah. Not the best source of toothpaste abrasive. Okay, and then your floss. Give me a moment to talk about floss. The most common and easily and great marketing floss is made of Teflon. Okay. Teflon is used for plumber's tape so that the pipes don't stick together. Teflon is used to line fry pans so that eggs don't stick to it. The unique selling property of Teflon is that nothing sticks to it. So let me ask you, if you're using it as floss, will it work?
Just sliding on by.
Exactly. Precisely.
So, but I imagine most people are using the Teflon floss.
Yes, at Costco, that's the only kind they sell is Teflon. Comes in a little gray box or a little blue box. And that I don't, in fact, I can prove to you that it doesn't take anything off the teeth.
Really?
I should do a video. Yes, there's a disclosing solution that stains the bacteria 3, bright pink, a deep purple, and a bright blue. Okay. And areas that are demineralizing will turn bright blue. If the plaque has been there longer than 24 hours, it turns purple. If it's been there for 24 hours or less, it turns pink. Okay. So I can go in there. I see these teeth have lots of plaque in between that's purple. I go in there with this slippery Teflon floss and I rub and rub and rub. Nothing comes off the teeth.
Really?
That's how I prove it doesn't work. Yep. It had just come on the market. I had my brand new big sample. This is thread, but big sample of this product that had come in the mail 20 some years ago. And I was all excited about using it. I'd used it all morning, and then I had a patient that needed me to show them how to floss. I disclosed. I go in there with my new sample of floss, and I'm rubbing. They're looking in the mirror, right? And they're watching me rub and rub. Nothing came off the teeth. I set it at the back of the counter. I said, well, we know that doesn't work. That's the last time I used it.
So what are you using in place of Teflon?
So the same company, you want to use a floss that has a lot of grab. So the fluffiness of floss, there's 4 on the market that I really like. One is the Burst floss. I like that because it expands easily and fluffs up nicely, and it's still got some tensile strength so it doesn't fray. Okay, so if people have some slight contacts that are a little bit tight, that will go through without breaking or getting caught. Then there is one called Twice. It's available at Walmart. It comes in a yellow box and it's much heavier. It does expand also. That's a good quality floss. Gum expanding floss, that's also good, but it tends to needs like some hot water to get, they put like too much wax on it or coconut. So I don't know what's on it, but it's too, it doesn't expand very well, very fast. And then there's Cocoa Floss, which is expensive, and it's great if you have slight spaces between your teeth. Okay. If you have tight teeth that are tight together, it's going to get frayed and torn, and that's not fun. Okay. So it depends on your teeth, if they're tight together or not. If you have large spaces or teeth that are missing, a really good substitute for floss that works better than floss is yarn.
Really?
Yes. Also, it works great for the back side of the last tooth. So you get an arm's length of yarn, wind it around your fingers, like you'll see on my site. So it shows you how to hold the floss, hook it around that last tooth in the back, and then do a little shoe shine action. With regular floss, do not shoe shine the floss. You need to go up and down the way the tooth grows. With yarn, you can, because it's so wide, it's not going to cut a notch in the tooth. With regular floss, you can do that. I've seen teeth that have a groove in the tooth from they don't know any better.
Yeah. Now walk us through, what are some of the best practices for flossing? Are you just running the floss through your tooth? Are you
Right.
You mentioned the shoe shine.
The objective to flossing is to wipe the side of the tooth clean. So you want to hug the tooth with a good horseshoe shape, okay, and wipe the side of the tooth clean. So you want to adapt the floss to as much of the tooth surface in between the two teeth as you can. So the little floss picks have a straight piece of floss, and they'll rub on the very center where the two teeth are side by side, but it won't hug the tooth. But if that's all that people are going to use, is better than nothing. Okay. But there's another alternative. Once you go between the teeth, you want to rub the floss up and down, and you want to make sure you use the outside and the inside fingers. All of this is on the website, GPS for flossing. Good control, proper direction. So you go up and down. You work close to the tooth, so you have good control. And S is simultaneous movement. Most people, when they floss, they get the floss between the teeth and they move just the outside hand. And the finger that's on the tongue side does this lame bounce up and down. It doesn't really hug the tooth and wipe the inside clean. And with the disclosing solution, I show patients that. I can tell what you do when you floss. I look in their mouths and I can tell them if they're right-handed. I can tell them if they're using an Oral-B brush, the round head brush. Sorry.
Yeah.
I can tell if they're using the round head brush. And what was the other thing? Oh, I can tell you how you're flossing.
Really?
And if you're using the Teflon floss, yeah.
Interesting.
And I can tell you what you're eating sometimes.
Really?
So definitely want to address the diet. But so for an average day, just to summarize then, you'd want to brush before you eat your breakfast, because I've seen some dentists promote that, or you want to brush after every meal, floss once a day or twice a day. So tell us the overall summary.
You want to brush each time you eat. Okay. You want to, and if you've had something acidic, you want to wait 30 minutes because the toothpaste will be more abrasive.
So acidic, like heavy tomato sauce or lemon.
And strawberries, and things like that.
Okay.
Oranges, grapefruit. So you want to brush. You want to floss once a day. If you will floss twice, even better. I had a patient who had a really deep, like a 10 millimeter pocket, and I showed her how to clean the area, and I recommended that she do it every single day. Well, this woman was originally from China. She was one of these overachievers. And she did it 3 times a day, and it healed to a 1.
Wow.
Which they will tell you that can't happen. It doesn't happen. Yes, it does.
Well, that's awesome.
it healed from a 9 to a 1. And another patient with a tooth mobility of 2, which means it was like, back and forth, up and down. We saved the tooth. The bone was able to reform
Really?
around it. Yeah, she was supposed to have an extraction and an implant. The doctor was so mad at me because it was a lot of money.
Yeah, he was like, hey.
But we saved the tooth.
Yeah.
That's something to rejoice about.
Oh man. Okay.
So then how often, and then mouthwash. Mouthwash for the most part is a waste of money, except there is an exception, okay? There's mouthwash that is prescribed. It's got chlorhexidine. It stains the teeth. I'm not a proponent of that. And now, finally, I'm so glad research is showing that it's not good to use. So don't argue with me, argue with the research if you're in the dental field, whatever. And there is a product called Dental Herb Company, and for fresh breath, and they've done other research to show that it actually makes gingivitis heal up, even in the presence of plaque, which I was so stoked and shocked to see. So you'll see that on the site too, under FAQ, toothbrush, toothpaste, mouthwash. They have a mouthwash and they have a toothpaste. I have tried using one because it's expensive. It's a concentrate. You just seriously need a very, very little bit. Seriously. So what I do, I brush my teeth first without toothpaste. I knock down the bacterial count, and then I take my toothbrush, I put a little dab of liquid soap on the side, and I rub it through the bristles because I have used the dye, rinsed the brush out, and it's still purple all in the bristles. So I used a little liquid soap, grabbed that plaque, and took it right out. I'm like, oh, so every time I'm brushing, I'm reintroducing the old plaque back into my mouth and just rearranging it.
Yeah.
So now I wash my brush out. So I'll brush my teeth, wash my brush out, then put a little smear of toothpaste on it, and then get that nice fresh feeling, brushing the toothpaste into my mouth. And then do the roof of your mouth, do the inside of your cheeks, because the tissue is replacing itself from the bottom up. Just like on the outside we exfoliate, the inside of your mouth has new cells coming up. The top dead ones, the bacteria love to attach to those. So do a little exfoliation, brush the inside of your cheek, do your gums, a quick swipe over them, and then you'll have that fresh breath. And use a tongue scraper. Feeling lasts much, much longer. And that particular product I mentioned has the highest fresh breath grade of all of the products on the market.
It's the Dental Herb product?
Dental Herb Company, yeah.
That's really great. So I just want to emphasize to people listening that it is possible to heal the gums, to heal the teeth. I mean, to a certain degree, right? With cavities, maybe when it gets too deep, you can't. But yes. Tell us more what the research says on that.
You need to get your teeth cleaned first. And I would highly recommend that you get your periodontal measurements taken. Make sure that their probe is readable. Now, as a professional, I'm not going to like if my patient asks me, can I see your probe? But you're the patient. And, if I realize that they've got some education and they're looking at the probe to see if you can even read the stripes. I don't have a probe here, but there's black and silver bands every 3 millimeters, 3, 6, 9, 12. They should be readable so that you know what you're reading. And then once they've done the measurements of the whole mouth, then I ask the patient if they have a moment, I want to show them how to read this. And I educate them on what it is that we've documented and where they need to improve. And I give that copy to them. I highlight all the deep pockets, and I tell them these are the areas you need to work on, and here's why. Because you don't want to lose your teeth, you don't want to have bad breath, blah blah blah. This gets in your bloodstream, and it can set up housekeeping in your pancreas. There are 8 cancers associated with gum disease.
I don't think most people even think of a cancer being associated with their oral health.
Right. Let me ask you something. If you had an open wound on your arm that bled for years, would you not see a doctor about that?
Oh, you'd be right on it.
That's such a profound point, because risk for colorectal cancer is rectal bleeding. Like, that's one of the 5, I believe, I've read. Or one of those few signs and symptoms that put you at high risk for colorectal cancer if you have anal or rectal bleeding. So that's such a profound point. Yeah.
Yeah. I have here one of my hand cards. I made a poster. Here, you can see some of the diseases. And I'll give the slides to Daniel, and he can put a slide up of this. This is oral hygiene education. It's waterproof paper. It's not plastic, but this is for hygienists to use chairside. So you can wipe it down. If you've got dirty gloves on, you can sanitize it, which is really, really cool. So I wanted to say you want to get your teeth cleaned, have the gums assessed, the health of that assessed, and then follow their instructions. If they tell you you should have your teeth cleaned, or if you need a deep cleaning, you will know. Let me tell you something. There's a lot of offices, sadly. I know my colleagues may not like this, that are practice owners, but the insurance companies are cracking down on it now, okay? Because there were a lot of offices that were scheduling patients for root planing that didn't need it.
And what is that?
A deep cleaning that costs $200 to $300 or more a quadrant. So 3, 6, 9, 12. So at least $1,200 for, like 2 visits, because they want us to do 2 quadrants in an hour. Sometimes it's $500 a quadrant. That's $2,000 and like $1,000 an hour.
So they are just unnecessary deep cleanings.
I had an office where the doctor actually had his license not revoked, but he was penalized because he was doing unethical practice, like doing root planing where there was no pockets. I had a patient in that practice. I was there as a temp, and I was measuring, and I said to the patient, okay, so I'm here as a temp today, and I have to be careful what I say, but I want to educate you what the numbers mean. So I told her, what gum disease is, what the numbers in a healthy situation are. And then I did her measurements, and I held them up to her, and I said, these are your numbers. You're scheduled for root planing today. What would you like to do? Because you're the patient and you get to decide. She looked at it, they were 1s and 2s. So gum disease is like 4 and deeper. Really, you don't do root planing on 4, but a lot of practices were doing that. It just depends on how much tartar is present.
Yeah.
That's not uncommon. If there's a lot, then you definitely want to be paid for your time because it's going to take a long time. But she had 1s and 2s and healthy tissue. And she said, I think I'll go now. And I said, I understand. Okay. So anyways, he'd been fined. So that does happen. It's uncommon. I want you to know that most dentists practice ethical dentistry, okay? Because it's drilled into us to do that. There are some that don't. So know your numbers. If the hygienist recommends a deep cleaning and your numbers are like 5s and 6s and they show you on the x-rays, you can see the bone loss. You can see the tartar on the x-ray if it's really heavy. Then you know you need a deep cleaning. Okay, and insurance is asking for x-rays now. And then after your deep cleaning, you need to see the office every 3 months. Let me explain why, okay? The tissue that forms that turtleneck, that's called gingiva. You've heard of gingivitis. The tissue from there down that holds your tooth into the socket is called periodontal ligament. It looks like little trampoline springs, and it allows your tooth to bounce up and down when you chew, okay? It doesn't grow back very fast. Gingiva does. So when you have the bacteria has eaten through that periodontal ligament and there's now no attachment, there's this space where the instrument will drop down in. We measure that against the top of the gum line. The root from the enamel edge to the root tip, your roots are 12 millimeters long. So if you have a 6 millimeter pocket and your gums have receded to where the enamel ends, that's a true 6. Half of your attachment is gone. Okay, so that's not good. So if we clean this out, now it's a nice clean root surface. and you keep that clean, faster than the little ligaments can reattach, the gingiva will grow down and fill that space. It does not attach to the tooth, it doesn't attach to the bone, but it fills the gap, and we consider that healing, quote unquote. However, if your home care slacks off, you quit flossing because things are good now, right? It'll unzip like that. And your 6 or your 8 that you used to have will come back because it was only gingiva filling that space. So 3 months, we go in there, we spot probe, I look at the measurements, and then I check to see if those areas are still healthy, if you've been unwittingly missing that spot, or there was a death in the family and your home care slacked off, that's happened. Then we can track that and show you where the areas that there's any recurrent disease. So that's why you should be on 3-month or 4-month recall. Now, there's a lot of offices that say you should be on 3-month recall for life. It depends on your home care. And, maybe the anatomy of the area is such that it's going to be difficult for you to access or whatever. There's other factors. But if your numbers were 6s and you got a deep cleaning and they're now resolved to 2s and 3s, and it goes on like that for 5 years, why do you still need to be on 3-month recall?
Right.
I don't know why you would be. So that's something that you should know, frequency of recall. So follow the professional opinion of your visits like that. You asked about diet. How can diet affect? All right. When you go to the dentist, where's usually the first place they start their cleaning? Do you notice?
I mean, when I've gone in, usually the first thing may be like an X-ray.
Okay.
But when
You mean on the teeth?
On the teeth. Where do they start? On the teeth.
Think in the front?
That's right. They usually start right here. Because under your tongue are 2 saliva ducts. Saliva is what carries the minerals into your mouth, calcium phosphate, that attach to the tooth. Now, the bacteria in your mouth live about 10 hours, then they die. They multiply every 5 to 10 minutes. 1 cell becomes 2. In 24 hours, 1 cell will become at least 5,000 billion cells.
Whoa.
In 10 hours, the cells die. They don't go anywhere. If they're not brushed off, in the period of 5 days, the dead cells, the cell wall, even though the inside's not vital, the cell wall will pick up the calcium phosphate from your saliva and solidify, turning hard like a fossil on the tooth or barnacle. Live bacteria like to collect on that rough spot. They die, then they fossilize, etc. This usually happens between the teeth, particularly with the round head brush or where people aren't flossing. And the more phosphorus you have in your diet, the more calcium phosphate you'll have on the teeth. Why? Phosphorus is a -2 ion. So you remember learning about the atom in grade school. You have the atom, the nucleus, and then you have electrons that spin around it, right? Okay. So phosphorus is missing 2 electrons. You eat a lot of phosphorus, your body meets the need, which is small. You don't need a lot of phosphorus. And all that extra phosphorus goes in your bloodstream looking for something to marry to get rid, so the body can get rid of it. What does it marry? It marries calcium, which has 2 extra electrons. So these 2 molecules come together, they share the 2 electrons. Now you have calcium phosphate. Your body can't use calcium phosphate, so it kicks it out either through the saliva ducts, forming tartar on the teeth, or through the kidneys, forming kidney stones. So the more phosphorus you have in your diet, the more tartar you're going to have on the teeth. I had a patient who had a perfect record, no tartar buildup, whatever. He comes in, and I always review the notes that I had last time, and I'm looking over that, and then I look in his mouth. I stop what I'm doing. I go over and I look at his chart, and I start going back and back and back. Every single time he's had a really good report. And I said, what changed? I said, how much phosphorus are you eating? I do this on purpose. How much phosphorus? He's like, what do you mean? And I said, how much meat do you eat? And he's like, well, I just started, bodybuilding. So I've changed my diet. I eat a lot of protein now. I said, it's showing on your teeth.
Hmm.
You have a lot of tartar buildup, a lot. And then I explained what I just did to you, and his eyes got this big. He says, I just passed a kidney stone. It was the most painful experience in my life.
Oh, yeah.
So there you go. I said, okay, I would dial back on all that meat. Now, why meat? Because you've heard of ATP, adenosine triphosphate. That's what makes our muscle contract. Meat is very high because it's muscle in ATP. Triphosphate.
3 phosphates.
3 phosphates for every 1 calcium. So people say to me, oh, well, I don't eat much meat. I just eat fish and chicken. Excuse me. I don't think chickens have roots and fish don't have leaves. Last time I checked. And I'll explain that if it has a mother or a face, it is meat. So,
Yes.
there you go. So your body takes in this phosphorus. It can't use it. It marries the calcium. Guess where it takes the calcium from?
The bones.
The bones? Yes. Which bones?
The teeth.
The ones around the teeth. That's right. These small bones. Now, doctors will look at the wrist bones because they're thinking these are the smallest bones in the body. I beg to differ, because the first place that we will see bone loss is horizontal bone loss, when all the bone around the teeth from front to back is slowly dropping, because the body is taking the easiest. Because when you chew, your teeth have these slight movement, right? The ligaments, okay? There's only 3 places in adults that produce calcium: the spine, the head of the femur, and the hip, but also the jaw bones around the teeth, okay? Not much, but your body will take calcium from these areas, marry it to the phosphorus, and then dump it out through the saliva ducts. But we'll also, those are what we're taught, these 3 areas, but we'll also see bone loss drop around the teeth. So it takes it from around the jaw bones, around the teeth, marries to phosphorus, and then dumps it on top of the teeth, which is irritating and causes more bone loss and more irritation.
That has to be a link to why there's hip fractures and osteoporosis in hips, and then denature of the spine. So you have lordosis and kyphosis because of the denaturation of the spine. Wow, I didn't know that. Like those areas where calcium is taken. Huh.
Yes.
Interesting.
That's why people get shorter as they get older.
Mm-hmm.
Yes.
Yeah,
I've asked 2 ER physicians, is it true that the head of the femur will snap off and that's what causes them to fall? They said yes.
Whoa. Oh, man.
I wanted to, before I forget, I wanted to talk about these inaccessible areas that you can't reach, and floss. If you have, so say you have measurements that are 7, 3, or 2, and then 7. If you've got, your bone level coming across like this and then dropping down and coming up, you floss, it's not going to get down there. So what do? There's a couple things you can use. One is called an end tuft. And that's a picture of that is under the brushes on the FAQ. I take patients there so I can show them what to go to Amazon to get. So I don't care whether they get it. It doesn't matter to me where you get it. Just get it. Okay. For a while, Amazon didn't carry that. And that's why I have it there, so that they can get it somewhere. Okay. Now they do. So that's great. All right. So you can slide the bristles of that down there. The other thing that you can use is there's 2 other things. One's called an endo irrigating syringe. You'd have to get that at a dental office and have to convince them to give it to you. And no, you can't get them on Amazon because they come in a box of 100. So yeah. The other thing that you can use is something called a hydrofloss.
Water pick?
No.
Okay.
I'm glad you said that. I did not.
Yeah.
So, an irrigator, people mistake this term of water flosser for something that will actually floss the teeth, and they won't, okay? It will blast food out from between the teeth. It's great for braces, for under bridges or implants and that kind of thing. It'll do that. But there is something, a physiological or physics. There's a law of physics called magnetohydrodynamics. It's a real thing. And I've checked it out, looked on Wikipedia and did some more research on it. So some brilliant, and I'm not being sarcastic, some brilliant individual who knew about the principle of magnetohydrodynamics applied that to an irrigator. They have patented an irrigator device with this magnet in the handle. So let me ask you, this is what I've learned to do with my patients. What does a patent mean? If something's patented,
It's protected.
it's protected. That means if you buy another irrigator, I don't care what it is, if it is not this particular one, it does not do the same thing. It will not use the principle of magnetohydrodynamics. I'm really emphasizing this because patients will not listen to me. If you want this to work, you have to get the one that's the patented device, okay? Nothing else is going to work. And I've seen fantastic things happen with this. They've done 5 research studies on it. 65% plaque reduction over any other irrigator. It'll reduce 65%, it'll remove 65% more plaque than the other irrigators remove almost nothing. So I had a patient with cerebral palsy who had lower front teeth here that didn't stand up like yours and mine like this. His lower teeth slanted towards his tongue about 45 degrees, and I couldn't get my scalers back there, and I couldn't polish at all. I couldn't Cavitron. I got a little bit off, but there was tartar left. And I'm like, this was early in my career. I said, my dad swears by this thing called the Hydrofloss. You might as well try that because we don't have any other options. I mean, the man can't use his hands. He's got cerebral palsy. So he bought one. By George, it made the tartar fall off his teeth.
Wow.
Yeah. I had another patient. I took a CE class by a periodontist, and he actually he gives the Hydrofloss to his patients that he puts implants in because it works so well. So another patient had plastic fillings all across these teeth with lipstick around the edges because they were chipped. And I didn't dare try and pick at that. It would just make it worse, damage her fillings. And I had her get one of these because of her gum disease. And she brought in one from Walmart, wanted me to show her how to use it. I said, no, take it back. So she had a real strong personality, so it didn't offend her. So she got this thing, and it actually not only removed this lipstick from under her fillings, it lightened her teeth 2 shades.
Oh, nice.
Really?
Yeah, they do not make that claim that it will take the stain out of your teeth. I've seen it happen, so I'm just telling you what I've seen.
Wow.
Yeah, it's an amazing device. So this does work. Follow the instructions. I've got 2 videos on my site that I had to search all through YouTube for it. So I spent about 45 minutes looking because I'd seen it 20 years earlier. The Hydrofloss website no longer has those videos because they're old, but one of them tells you about the science about it, and the other one tells you the use and care. Mm-hmm. So, it's kind of grainy, just go with it, but the information is unchanged.
So since you mentioned that this device lightened the color of the teeth 2 shades, have you looked into the research on those blue light? Didn't you get one?
Yeah, it was like a blue light with a paste that you would place in the device.
Yeah, what are your thoughts on that kind of stuff? You see, so influencers use them, and
yeah. So yeah, no, it doesn't work like you would think, like the ads say, from what I've been told by people who know better.
Okay. I wanted to also ask about hydroxyapatite and hydroxyapatite toothpaste. That's something we've looked into, and as far as what are your thoughts and what does the research say on using hydroxyapatite to restore and remineralize the teeth?
Yes.
Mm-hmm.
Just yes. Hands down over fluoride. Yes.
Yes.
Just
okay.
Use that.
Okay.
Yeah, I won't spend a lot of time on it. If someone wants to research it, they can. But
Yeah.
the answer is yes, use that and not fluoride. We are not suffering a fluoride deficiency.
Okay.
We
Now,
don't have decay because of a fluoride deficiency.
now, in your professional opinion, can somebody heal cavities?
Yes and no.
Okay.
I have seen very small cavities remineralize.
Mm-hmm.
Okay, and I've seen in one of my Facebook groups for dentists that very small cavities sometimes do not progress. There's dentists that are more conservative and they won't restore teeth, that they want to watch something that's very small and they'll see if it progresses. Sometimes they don't. We don't know why. I took a whole class on oral environment and dental decay was the name of this class. And we studied all the different theories of what causes decay. And I'm like, how am I supposed to know what's on the exam? Like, I don't even know how I managed to pass the class because it was all confusing to me. All these different theories of what causes decay, whether it's from the outside, does it occur from within the tooth? I'm just like, yeah.
Mm-hmm.
So you can remineralize if the area. I remember one patient was really upset with me because I showed him he had a space between the teeth and I told him use yarn or gauze or something because he had decay there and keep it super, super clean. So he did that. He came in and the instrument would not stick in it. It had like the area had remineralized. He was upset. I got upset. I'm like, now you don't need a filling. Why are you mad?
Yeah.
He's like, you told me that was a cavity. Well, it was, but it's not now. What do you want to do?
Well, that's
drill it anyway.
Well, you mentioned fluoride earlier, so what should people know about the use of fluoride in oral care?
Great question. I'm glad you asked. I'm working on a master's degree in global health. And one of the classes that I had to take was nutrition and global health. I had to do reading assignments. One of the reading assignments had something to do with, or a book report. And one of them had to do with fluoride. It was very interesting because I was not aware of, let's see, what's it called? I think it's scholar.google.com.
Mm-hmm.
Okay, so you can look up research that way. And I typed in fluoride, and the very first hit was like a gold mine. And I had learned about this years before from a stranger at a health food store. They'd give me a VHS tape. That's how long ago it was. And it was really eye-opening what I learned from this person. But this study substantiated everything that the other person had said. It's toxic. Now, if you will take, I don't have one here, I should have. If you'll take your tube of toothpaste or the box and read the side, it says, warning, if swallowed, contact who?
Poison control.
The Poison Control Center. That's right, because it's poison. And I'll tell you what else. When I was in hygiene in 1982 to 84, we didn't have the varnish that you can paint very localized and it sticks to the tooth, if it's done properly. And in some instances, that is in order. I will tell you that, okay? I don't use it very often, but once in a while, I'll say to the patient, this is going to be the best course of action for you right now. So let's do this. Anyway, the only way that you had to deliver fluoride was with these 2-gallon containers with a pump and these little cups with milliliters on the side. You had to measure so much of one and so much of the other and then put it in a cup and mix the two parts together and then have that child swish with it. You had to keep an eagle eye on them because if they swallowed it, it could kill them. And this is a real thing. I am not exaggerating at all because I wish I had taped that to my wall, but I actually saw before they moved to foam in the trays and then they moved to something else. I forget what it was. there was still this liquid. There was a little blurb in one of my dental hygiene magazines about a child that died. Well, the hygienist and the mother were chit-chatting and the child was swishing for 2 minutes. It's a long time to swish for a little kid. He swallowed it. They took him to the hospital, had his stomach pumped, but it was too late. The child died.
No. Now, I was speaking with a dentist about a month ago, and we were talking about this fluoride, and he said, it's a bunch of baloney. You're only using so little, such a little amount in your toothpaste. Don't even worry about it.
It makes me sick to my stomach. Why would you re-expose yourself to that over and over and over, like 2 to 3 times a day? Because you do swallow some. You do. As much as you try not to. It's my body is very sensitive. I detect it. It makes me ill.
Wow.
Now, question, you mentioned earlier as far as recession. I have some recession. What are some of the best practices that I can incorporate, others can incorporate to assist with recession? Because I'll notice some tooth sensitivity because of that.
One more thing about the fluoride that came to mind. In order for fluoride to work on the tooth, because there's 3 different kinds of fluoride, in order for fluoride to be effective to prevent decay or arrest decay or help with sensitivity, it has to be on that tooth surface for 4 hours.
And you're brushing and you're swishing and spitting out.
That's correct.
Interesting. I know when I've gone to the dentist, they have said, okay, if we're going to put this on your tooth, you want to leave it there. But I think they usually just say about an hour, 30 minutes or an hour, and then you're okay to brush.
Yes, that's the fluoride varnish, and ideally it should be on there longer than that. So yeah, at minimum a couple hours, minimum 2 hours, minimum. Ideally, because it takes a while for it to bond to the enamel and start to incorporate into the mineral structure of the tooth. So ideally, if you're going to use varnish, dry the tooth really well so the varnish has a chance to, flow into the deep areas. There's not saliva in the way. Paint it on, and saliva is what helps it to become really tacky and stick. So then after it's, painted on, then, the person can close their mouth, but don't brush it off and all that kind of thing. So, and it will help with sensitivity. I will tell you, I had braces. I've had braces 4 times. Yeah, and it wasn't because I wasn't wearing my retainers. Long story, not necessary. But I had some recession from my teeth being torqued around, moved this way and that. And I was not realizing that using the Sonicare, good brush, however, the brush head that comes with it in the box is a medium, like the Diamond Cleaned or whatever comes in the box. Those are not soft. I don't care what anyone tells you, that's a medium head. And it was stripping the tissue off of the roots of my teeth. And it was so painful to talk, to laugh, cold air. And I even to this day, I put water in my mouth and I have to hold it a while before I swallow because it gets on my teeth and it's painful. But there is a product that will help the sensitivity like that. It has fluoride in it. They don't make it without fluoride. But all I needed to do was use it once, and it fixed it. So now, like the HydroFloss, listen to me carefully, everybody. Rapid Relief by Sensodyne. Oh, I use Sensodyne. Okay, stop, listen. Rapid Relief. Sensodyne makes probably 10 to 15 different toothpastes. They're all Sensodyne, but the chemical makeup of each of them is different. They come out with new products all the time because that's how they stay relevant. The one that came out a few years ago, I forget how many years ago, 7, 8, maybe 10 years ago, Rapid Relief is the bomb. It is so, so effective. If you have sensitivity to cold or whatever, it will be fixed like the very first time I put it on my teeth. They'll tell you it takes a few exposures. Not for me, it didn't. So just get a tube of that. It'll fix the sensitivity for you, Daniel, and you'll be in good shape.
Yeah. Now, what about the gum recession specifically? Is there anything you can do to reverse that?
No, you can keep it from getting worse. Yes and no. Let me qualify that. You can't bring the gums back up without surgery. Okay, you can't, if it's really advanced recession, then you might want to talk about having surgery done. If it's just a little bit, just fix the sensitivity of it and don't bother with the surgery, because the surgery is uncomfortable, i.e. painful. So I would just, do something so it doesn't get worse. What causes recession? Grinding your teeth, brushing improperly, brushing too hard, using a hard toothbrush, braces. Those are the most common ones. Clenching your teeth will also cause recession. A diet that's causing a lot of bone loss will cause recession. Those kinds of things will cause the gums. Starting in the same spot every time you brush your teeth will cause recession.
Pushing so hard with a round-headed toothbrush will cause recession. Okay.
I'll look in someone's mouth and I'll see these left bicuspids with no tissue on the roots. And I'll go, are you using a round head toothbrush that's electric? Go, yeah, how did you know? Let me show you.
Okay, want to ask specific oral health issues children should be aware of.
I'm creating a curriculum for the Kenya Medical Training College, and when the students graduate from nursing, public health, or nutrition, they're going to have training in how to go into the community and set up a preventative oral health care program for to be given every 2 months, one for adults and one for parents of children, because the parents need to do the brushing with or for the children until about the age of 10 or 12. Okay, I know that seems old, but that's what's really best. So it's not necessarily what the children are aware of. The children need to be taught by the adults. Okay, so I'm more interested in training the adults. Children, if they're like teenagers, you want to call them children, that's fine, but they have all their adult teeth. So I'm considering them as adults. So the specific health issues are, if you're going to have sweets, and I understand the desire for that, brush your teeth after, or have it with a meal. Have it midway through the meal so that you're not ending with the sugar on the teeth. Okay, that's my experience. And you're not left with that sugar on the cilia of the throat, which is where sore throats come from, because it paralyzes the cilia of the throat, and then it's not brushing the bad guys up, because you've ended your meal with something sweet. That's like not the best idea. So I have my dessert before I finish my meal, and then I finish my meal with something savory or whatever. That's how I protect my health.
Nice.
Okay, so brush your teeth. You asked me about brushing before or after breakfast. You should brush after breakfast. I understand if you want to brush before breakfast. I've been told that it lowers the vitamin B12 that your mouth will like naturally make. I don't know where you stand on that. I'm open to education on that. I don't really care about that. I want people to brush after they eat, because my area of expertise is preventing gum disease and decay.
Yeah.
So whether you brush before, I don't care. You do need to brush after, because I have patients say to me, I brush before I start my day, and then I come home and I brush before bed. They think they're doing great. They're brushing twice a day. Okay, so let me take you through this. You get up, you brush your teeth, then you have breakfast, lunch, and dinner, and then you brush, sleep, and brush. You're brushing twice after dinner.
How does pregnancy affect oral health, and what precautions should pregnant women take?
Pregnancy causes a lot of hormonal changes, as you know. And one of the first places that we will see it is in the mouth. The gums become more tender. Same thing will happen actually around the menstrual period, believe it or not. The gums will be more tender. They'll bleed more easily. So same thing with pregnancy. And you want to have immaculate oral care, because any amount of plaque will cause the tissues to like go crazy. They'll get, very swollen. They'll bleed very easily. Almost every time, not in every person. I have seen someone that's pregnant and she didn't seem to have any problems, any issue, but her home care was pretty on point, So if there's any time that you want to start flossing, I would definitely do it with pregnancy. Absolutely. Get your teeth cleaned during I think it's the second trimester, not the first or the third. And then make sure that you're flossing all the time, because you do not want all this bad bacteria floating through your bloodstream, which is also going to your baby, which can affect the baby's health.
Yes, you mentioned there's a risk for preterm birth with that. So tell me more about that.
Well,
why? Like, what is going on there?
I don't know all of the physiology of it. We didn't get into that, but I imagine because it's got a blood clotting factor in it. It's doing something to the blood flow. It's restricting the blood flow, and the baby's not developing as much as it should, like low birth weight, And then preterm, I'm thinking probably the same thing, but that I would have to do some research and get back to you on that.
Yeah, okay. Now, a friend who's a nurse and a dietitian mentioned to me that there's a higher incidence of cavities for breastfeeding women, and that has something to do with the calcium that's being possibly leached from the oral area, the teeth or bones, because the baby's needing that calcium to grow and to build bones. Is that tell me what you're thinking with that. So is that true? I don't know.
It is impossible to take calcium from your teeth, that are developed and erupted, once they're developed and erupted, unless you're talking about leaving plaque on the teeth and eating a high sugar diet and soda. Let me talk about soda. Remind me to talk about that. It doesn't happen. It just does not happen. Okay. I don't know. It's an old wives' tale. Truly it is. And if you don't believe that, take it up with the litter. Go to Google, to scholar.google.com. Do your own research on it. That's what I suggest if you don't believe me.
You can't believe everything anyone says.
You need to investigate. Okay. So the baby does not take calcium from the teeth. I have had people say, yeah, my teeth just went down the tubes after I had my baby. She, I nursed and she took the calcium from my teeth. I'm like, no, probably you were so busy with this child that you didn't have the home care you did before, because you've got to be up all hours of the night with the baby that needs to be fed and changed and taken care of, and all of that is going to make your home care slack. I get it. Like I've not had kids, but I totally understand how that could be an interruption of your oral care.
Thank you for clearing that up.
Now, we talked about brushing and when we should brush, before a meal or after a meal. But tell us, what about, and you just mentioned this a moment ago, sodas, but also talk about juices as well.
Thank you.
Yes. Yeah.
Yes. So soda has two bad things about it. One is, three. The carbonation, the carbonated water is very bad on the teeth. It's very acidic. Even if there's no sugar, if it's just carbonated water and there's no sugar in it, it's still very erosive to the teeth. Don't do it. Okay. And I just learned that this year, all right, from my periodontist that I work for. The other thing is the sugar in it. It's going to, when you're drinking soda, the sugar pools around the gum line and in between the teeth, and it's acidic. it turns to acid in just a short time. In under 30 minutes, it's, eating through the enamel. And then you have the carbonation, the sugar, and then in some sodas you have phosphoric acid, which children, if their parent is aware of it, will use this as a science experiment for class. They'll get a Coke and they'll go to the dentist and get an extracted tooth, drop it in the Coke, and I think it's in a matter of 7 days the tooth is dissolved. Yeah, I had, and a point of fact, I had a patient who came in the operatory. Okay, he comes in, he sets down his soda bottle, and because he carried it with him, he carried soda with him everywhere. And I look at his teeth and I'm like, let me hand you a mirror. So he looks in the mirror and I said, you see this circle on your teeth? It matches perfectly. Mm-hmm.
Oh,
It had eroded the enamel in a perfect circle. Mm-hmm.
How interesting.
Oh, wow.
Yeah.
Oh my goodness.
I would advise that you eliminate that from your daily habit.
Yeah.
Yeah. So soda is really bad for the teeth. And on little children, I just had somebody yesterday, a little kid, whose mother was letting all the children drink soda all the time. And all the kids, 2 of the 3, I take that back. One had a problem with gum disease, and one is acidic and one is basic. So you're not going to have a problem with both. Either a person has a problem with decay or they have a problem with gum disease. It has to do with the pH of the mouth. Anyways, 2 of the little kids had no enamel on the top half of all of these teeth. Yeah, because the baby teeth are, the enamel is very thin. It's like a little shell, okay? And at the gum line, the top half of the tooth, that shell gets even thinner because the enamel tapers off. It tapers off and ends, this part. And so any plaque in their home care was atrocious. And so they're rinsing this acidic, liquid over this plaque several times a day, many, all day long. And it just completely dissolved the tooth on the top half.
Wow.
Oh my goodness.
Yeah. Oof. So I'm not a fan. So I told the patient's parent today, another patient, similar problem. I'm not saying you can't ever have soda, but I would restrict it to summer vacation and Christmas dinner. That's when I would do soda. Okay? Special occasion, not like a daily dietary thing.
Not even a weekly.
Not even a weekly, right. Just don't. My parents didn't have it in the house. We had it Christmas dinner. We had ginger ale that was, with whatever juice, grape juice. We had white grape juice and we put ginger ale. That was the Christmas drink. Special.
That sounds
And then I had orange crush when we went to Canada, and that was the extent of my soda, which is good. I got nice teeth now. This is great.
Yeah.
And you asked about juice.
Yes.
Thank you for asking about juice.
Yes.
Juice is not good. It's missing all the fiber, and it spikes your blood sugar, and it creates this great insulin release. And it also will sit along the gum line and in between the teeth and cause decay. I had a little boy who drank grape juice all the time, lots and lots and lots of grape juice. And I looked in his mouth. I didn't know that, but I looked in his mouth and I'm like, why do you have red wine stain on your teeth? Like, you're 8 years old. And I saw, what was typically red. And I said, what do you like to eat or drink? And he told me what he liked to eat. And I said, what's your favorite thing to drink? And he said, grape juice. I'm like, oh.
There it is.
So grape juice, there it is.
Yeah.
It stained teeth.
Yeah.
I've seen spinach stain. One patient, I ate spinach every single day. She had green stain on her teeth.
Really? Well, now we know the health benefits to leafy green. So how would you advise this person then?
I would suggest a sonic brush.
Okay.
And like I said, if you get the Sonicare, if you get the Sonicare, get the sensitive head. Otherwise, I personally use the burst because the bristles are feathered. And so it's very, very gentle. So you can use that and get the plaque off or the stain typically, and using the method that I show people, keeping the handle level or parallel, and you'll avoid getting stain built up on your teeth. And if you were to use the burst and the hydrofloss, those would be synergistically the best. Which reminds me, I had started to say the dental herb toothpaste and mouthwash, they work synergistically together. I had tried patients using just one and just the other to see what kind of result we'd get. They really have to be used together to get the result that the studies will show you'll get. Yeah.
That's good to know.
So what about fresh juice, though? Do you have an opinion on that? Because I know that's something that we incorporate as part of our cleanse and detox routine, which is what our guests are drinking every day, but it's not. Yeah. It's only for a specific concentrated amount of time. So.
It's medicinal, in my opinion, and I wouldn't worry about it.
Okay. Yeah.
It's like their meal. Like, don't take away their meal.
Yeah.
Yeah, it is their meal during that cleanse process. So.
One thing I started doing was I noticed some spots on my teeth, and I think I associated that to drinking a lot of fresh juice during our programs. So I made a point to brush my teeth after I would drink the juices.
There you go.
Yeah.
I would do that.
Okay.
Just allowing them to stay, they'll kind of start incorporating themselves into the pellicle of the tooth. It's a protein film. That's what makes the teeth feel slick.
Yeah. Okay. Now, we're coming to a close here, but I wanted to ask two more questions. One, are there any myths in regards to oral health and dental hygiene
that you would like to dispel?
Yeah.
I'd like to, yes. Let me spill the tea on this. The one is that you can heal a tooth that needs a root canal. Please don't do that. If the tooth needs a root canal, the abscess is going to get into your bloodstream. If it's an upper tooth, it can go into your brain and kill you. So get the tooth either extracted or treated. From what I've read and what I've studied, and someone that I know who had a stroke right after their root canal, I would just have the tooth removed and have an implant put in.
Really? Yeah.
Why? Because my dad was a dentist, like I mentioned, and he would do root canals in patients, and he did really good root canals. And the reason I say that, not that it would change my mind, but what he explained to me is that the nerve chamber of the tooth, that hollow core where the blood and the nerve supply is in the middle, that's what gives us this ability to sense pain, has more than just that main canal. There's little tiny nerves and blood supply, mainly we're talking about blood supply here, that goes all through the root of the tooth, you know, all like roots of a tree. They're minuscule, tiny, tiny, tiny. You're not going to be able to get the infection, the infected blood cells, out of all of those little tiny blood vessels. You can clean the main one, and you can put some kind of antimicrobial in there, but then you have dead white blood cells and so on inside the tooth trapped in there. And what if you didn't use a way, because I've seen dentists use these hand files. My dad did not use, he didn't believe in those hand files. He used a handpiece with a specific burr that would smooth the inside of the nerve chamber completely into a cylindrical thing and smooth all, because the canals, you know, they're irregular surfaces. You use a hand file, there's going to be little areas where, you know, the file misses, you know what I'm talking about? The bacteria and so on in there. So anyways, I just wouldn't trust having the nerve and everything removed and that not everything is removed. That can be in the, you know, in the walls of the tooth. That's my personal opinion. This isn't something as that an endodontist would agree with, I'm sure. But as a thinking, using logic, you know, using my what's the word I'm trying to think, cognitive ability, and using deductive reasoning, I'm thinking probably I would be safer just having an implant done.
Well, we definitely value your opinion because you're very health conscious. You look at the whole person as well, you know, and so you're looking at you're thinking about what is going to be more of a risk and have more toxicity to it. Like you mentioned, fluoride, and I wanted to mention also fillings, and I know, doesn't silver fillings have mercury still in them to this day? I mean,
yeah, there's very few dentists that place mercury fillings. Extremely rare to find them.
But
there's a few.
But they do
Mostly they
silver or the white composite, right?
Composite fillings is what almost everybody uses.
Okay. But so is there any mercury though still in silver fillings?
Yes.
Yeah.
So people that have silver fillings, that will be off gassing.
Yeah. Yeah. So so do you recommend people who've had silver fillings to have those replaced? Because I know that some people have claimed they've had their chronic health conditions clear up once they've removed those silver fillings.
I would.
Yeah.
Why? Yeah. And yeah, you want to have that done in a way that it's not creating a lot of aerosol, so everyone's now breathing the mercury. Make sure that they put a rubber dam so that not all that mercury and silver the dust and everything's going to the back of your mouth. The tooth should have a rubber dam on it if they're going to remove the silver filling and have the proper, like we've had COVID. And a lot of offices got these air purifying. Those things are fantastic. I wish offices still had them running, because when I polish or do cavitroning, all this aerosol that you cannot see is all in the office, in the air. And when we had those machines running, it would clean and purify the air. I could smell the difference when I came into work.
Praise the Lord.
Yes. It was way better. I'm like, we should have these all the time. I'm so glad offices, but they didn't keep using them because they're loud. It's annoying, but how great if it was incorporated into the HVAC system, that'd be awesome. But if you have one of those machines sucking the air as they're doing the high speed, the drilling, and because some offices, there's a few offices, very, very few, that practice the kind of dentistry where they'll remove those with like really high precautions. They'll take it super seriously, but a lot of dentists don't.
Thank you so much for, sharing this information with us. I think it's been really valuable, because so many times I think we could overlook our oral health, or you're in a rush, so you're brushing your teeth really quick and you're not that thorough, or you're not using the right toothbrush. So thank you for everything that you've shared during this interview. As we close, is there anything else that you would want to leave with us?
Yes. I encourage you to go to the website and watch the videos there, because it will be very, very, very helpful. We forget, so you've watched this lecture in 20 minutes. In fact, you've probably forgotten about 50% of what you heard from the beginning of the lecture, because in 1 hour you forget almost 47% of what you learn. No, in 20 minutes you learn, you forget in 20 minutes almost 50% of what you learn. In a week you'll forget 78%. So that's why I made my site. It's just I pay the domain fee and everything every month just out of pocket, just because it's something that I feel is important, and I use it for patient education. There's no money to be made on that. So, if you want to buy things through the site, fine, but that's not why I have it. I have it because I want people to follow through. In reality, if they do better with their oral care, I can practice hygiene longer, because their cleanings will be easier and I don't have to work so hard next time they come in. So that's what I gain out of it.
Win-win.
Yeah, for sure.
It is. Just make my job easier. That's what I want.
Yeah.
And you get the benefit. You get to have healthy teeth and you live a longer life. There was what's the guy's name? I forget his name. Not Esselstyn. There's another one who says that flossing every day will extend your life by 6 years. I have not seen a study on that, but I'll buy it. It makes sense. Bacteria. It's going to certainly help reduce your risk of these other diseases. So that's what I would want to add, is go to the website, watch the videos, brushforlife.com, And if you have any questions, you can contact me. My cell number is at the bottom on the footer.
Wonderful. Yes, we will absolutely leave your web address and your contact information. So if individuals have questions, they could reach out to you, I imagine, correct?
Yes.
Okay.
Yeah.
And then you're not only a dental hygienist. I mean, you present at different events and different conferences. So individuals, if they're interested in bringing you in for a corporate event or a speaking engagement, they can reach out to you as well through your website for any speaking requests.
Yes, through my phone number. Yes.
Okay.
That would be fantastic. I'd love to do that. My desire is to do corporate health and wellness speaking full time.
Yeah, wonderful.
All the best to you, Lynelle. Thank you so much. You were definitely a very dynamic presenter, and we learned a lot. We covered a lot of information. It was very, very informative, interesting, and educational. So
yes, we encourage you all to start brushing and start flossing and take care of our teeth, right?
Yes.
God bless you. Bye-bye.
All right. Bye-bye. Thank you so much.
Bye-bye.
If you enjoyed this interview, please leave a comment below. Let us know what was valuable for you or something new you learned.
Absolutely. And stay tuned for our next interview. It's with Dr. Brooke Goldner. She's reversed many of her own autoimmune conditions, and she is on a mission to assist individuals in treating and reversing their autoimmune conditions as well. She's an author of a few different books, Goodbye Autoimmune Disease, and also Goodbye Lupus as well. So I know you're going to love this interview. Until then, God bless.